welcome to Wellness Health Services Health Talks. In this live talk, we are going to look at asthma in adults and children. And basically, we are looking at what each family needs to know about asthma. It is important that everybody understands what is asthma and also have some basic ideas on how to prevent and to treat asthma at home, because this is a common condition that affects children and the adults equally. I'm Dr. Joshua Dirito, a family physician. So we are going to look at what is asthma. And basically, asthma is a chronic inflammatory disease affecting the airways, especially the large airways and the small airways as they narrow down towards the head of the respiratory system. It is usually a reversible condition, and there is increased sensitivity and narrowing of the airways leading due to some triggers which we will look at as we continue. So the symptoms of asthma are characterized by wheezing, there is coughing, which is usually worse at night, this shortness of breath, and also the individuals affected also have chest tightness, and they feel like they are struggling for air. So asthma is like trying to breathe through a straw filled with cotton. That is the kind of feeling that people who have asthmatic attacks have. So what are the commonest triggers that trigger this condition? One is we have conditions like cold air. We have dust mites, which are common in our homesteads. We also have smoke, which is a big cause. Usually, what happens in asthma, you have exposure to a particular trigger, and once you are exposed to this, then the airways become hypersensitive, and they respond by increase in mucus production. There is also swelling of the airway wall, and then there is tightening of the smooth muscles that surround the bronchus, and then the mucus production. And all these lead to difficulties with the breathing. So once this happens, then the individuals have difficulty breathing, and the air is narrowed, and so it's like you are breathing through a very narrow airway, which affects your breathing. So what are some of the commonest triggers? We have said dust, we have pollen from various plants, we have molds, which are those that happen in houses, especially in moody weather. Then we have cold air. If individuals who are sensitive to triggers engage in exercises, the exercise itself can serve as a trigger. Exposure to tobacco smoke, then some perfumes, and then infections. When someone who is predisposed to asthma is exposed to some infections, then they get bronchoconstriction, and they have difficulty in breathing. Then we have pets, especially things like cats, dogs, which we have in our homes, and also some of the not really pets, but some of the mites that we have in the houses, like cockroaches. So it is important that people who have asthma, they keep a diary of when they have their attacks. This will help their doctor to really have an idea of what is causing the trigger, and they can also record when they got the attack, what was happening. Was it in cold weather? Did they get to exercise? Did they eat a particular type of food? Because all this, for you to know the exact trigger, then you need to have an idea of what is causing the trigger. So what is the difference between the asthma in adults and the asthma in children? Usually causes, if you look at causes of asthma in children, many of the asthmatic attacks in children are usually allergic. So there must be a trigger from the environment. And in adults, these are usually mixed. and not characterized by any allergen always. Then the diagnosis in children is more challenging because kids do not know how to talk for themselves and to explain how they are feeling. They may have a persistent fever, and then in adults you may use a spirometry, which will be able to measure how someone is breathing, and this will give you an idea of what is happening. Then the triggers in children are usually viruses or allergen. They may have a flu or a common cold. In adults, they may have things like environmental stresses, stress, which could be physical or emotional. And then you have infections like pneumonia, you have viral infections. Then response to medications in children is really fast and rapid. Adults, the response is a bit slower, and it needs long term to control in adults. So there is the severity classification of asthma, where we have intermittent asthmatic attack, where you have asthmatic attacks occurring in less than 2 days per week. Then you have mild persistent. Usually the attacks are they take more than 2 days and not on a daily basis. Then moderate persistent attacks, where you have the attacks on a daily basis and the symptoms are severe. And then severe persistent asthmatic attacks, where the symptoms are persistent and they are continuous and the symptoms are severe. So this helps in treatment decisions depending on the severity and how persistent the asthma is. When we look at the medications that are used in the treatment of asthma, there are different categories. We have the relievers. The relievers are the medicines that are used to relieve once an attack has happened. Usually we call them the short-acting beta agonists, drugs like salbutamol, albuterol, which you use to relieve an attack that has already happened. Then we have the controllers. These are drugs that you use to prevent an asthmatic attack happening. And we have the long-acting inhaled corticosteroids. We have the long-acting beta agonist, and then we have the leukotriene receptor antagonist. So the controllers prevent the attack, but the relievers treat them. So once you have an attack, then the controllers, yes, especially if you are using the long-acting beta agonist, they are helpful, but they do not help to relieve the symptoms immediately. So you need the relievers for quick relief of symptoms, and also that the distress of the attack can be relieved immediately. So drugs like fentanyl or the salbutamol become very hardy when already someone has gotten an asthmatic attack. So they are various devices that are used to deliver the drugs to the airway. We have the metered dose inhaler, which requires conditioning. We have the spacer with a metered dose inhaler. Then we have the dry powder inhaler with which are breath activated. Then you have the nebulizers, where you have a machine that is used to nebulize someone, and this helps to relieve the airways. Then you have peak flow meters, which are used to measure the lung functions. So when we are talking about the asthma classification, then it is important to know that you try to have an action plan for the kind of attack that someone has. So when we are talking about someone being in the green zone, he has no symptoms and he can continue with the controllers because his asthma is well managed. Then the yellow zone, where there are mild symptoms, you may just need to adjust the dose and then monitor the controllers. Then you have the red zone, where there are severe symptoms and the individual needs emergency care. This helps the family to know when they need to go to the emergency room and when they can be at ease and just continue using their medication. So what are some of the tips to try to control the asthma at home? One of the things that I would want to say is that it is very important that when you have someone in your family with asthma, it is important to know how to use the devices that we have talked about and use them lightly, because many times we have individuals, they have the devices, but the use is not very good, and so you find that you may be using the inhaler, you're not using it the right way, and then the benefits are not achieved. So some of the tips that you can use at home to relieve an attack, one is allergen proofing the beddings. Some of the things that you can do is using blankets or mattresses that are dust mite proof and which do not accumulate dust. This will really help to reduce the attacks. And then for those individuals who are family members who smoke, it is important that they avoid smoking in the house, and even after if they have smoked outside, they should take at least half an hour before getting to the house. Then humidity control in the house is very important because it helps to relieve the possibility of the attacks. Then you have, apart from the humidity control, you have the physical activity, because usually if the individuals engage in exercises, this helps them to manage the exercise-induced asthma. And then for those who have asthma, it is important that they get the flu vaccines. This will help prevent them from getting frequent attacks from asthma, from common colds and the things like influenza, and this will help to relieve the attacks and reduce the number of episodes, because as we have said, one of the triggers for asthma is viral infections, and recurrent viral infections increase the number of episodes and also the severity of the attacks. Then it is important to know that when to seek help, especially when you have an attack. If you have rapid worsening of the symptoms and the use of the inhalers, either the relievers and the controllers is not helping, then you need to seek medical advice and go to the emergency department. When the reliever is not helping, it is important to get the emergency room. When you find that the individual who has an attack is getting bluish lips because there is curtailed oxygen supply, either in the lips or in the fingernails, it means that the oxygen supply is poor, and this could be life-threatening. When someone is in an attack, is not able to finish a sentence, he's talking in words or they have difficulties even saying a word, then that is a sign of a severe attack. Then if in doubt, then it is always good to seek help, because asthma, remember, is a life-threatening condition, especially when you have an acute attack, and it could endanger the life of the individual who is affected. So it is always important that when you see some of these danger signs, then you rush to the emergency department. And if you know how to use the relievers, you are using them well, there is no response, then get help. So what are some of the questions that people have questions about asthma? So can asthma be cured? People need to understand that asthma is a condition that is caused by triggers in the environment, and it is the leading cause of this is a genetic factor which the individual is carrying along with his life. So as far as the individual is exposed to the triggers, then they will get an attack. The important thing is if some of the triggers can be avoided, then the individual will not get the attacks. For example, you may find that individuals who have the asthma triggered by pollens, their asthma attacks will worsen when we have the flowering of most of the plants, and so they get attacked at that time. There are those who are cold sensitive, so during the hot season they are very comfortable, but then when the cold season comes, they get a lot of attacks. There are those who are sensitive to dust, and during the cold weather they are very okay, but let the dry spell comes and dust is in plenty, then they get attacks. So inhalers are addictive? Not at all. As I've said, there are two types of inhalers. We have the controllers and the relievers. The relievers, you use them once you have an asthmatic attack to relieve the congestion and to try to open up the airways. And they are very helpful, especially in the presence of acute attacks. Then you have the 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 controllers which are used to control the attacks. So they help control the immune response that trigger the asthmatic attack, and so they act by relieving and stopping the immune mechanism that is responsible for narrowing the airways, and so they help individuals to stay comfortable. So that is very important to know. These inhalers, they are not addictive. They work in that way, and they should be used so that for children, they have a better life. They can cope up with the daily activities of living. They can live a normal life as children. They should not be able. They should not have their school program interrupted, and they should be able to play as any other normal child. And for adults, these persistent attacks, of course, they are life-threatening, and also if they happen persistently, this can lead to persistent airway lung destruction, and can lead to subsequent complications of the cardiorespiratory system. So can a child outgrow asthma? Usually not, but if the relievers, if the triggers that the child is sensitive to, sometimes adequate exposure of this child to the triggers may help the child become desensitized, and they do not respond with an attack. So as small children, they may have more attacks, but as time goes, you realize that the triggers lessen, and so the frequency of the asthmatic attacks decreases. So asthma is manageable, is not curable. Then it is important to know the triggers, know the medicines that you are using, and use them appropriately, and have an action plan on what to do when you get the symptom. Because again, the attack does not, occasionally may have an attack just setting and worsen within a very short time, but it progressively worsens with the time, and it is important to know how to use the devices correctly. Every time you have a device that you're not sure of, it is always good to ask your healthcare provider to teach you how to use it. There are also some videos that are found on the internet, like the CDC website. They have various videos on how to use the various devices, and you can just log in, and you'll be able to see the devices, and you can just do, and they will show you how to use it. Then it is important that the whole family knows how to take care of an individual with asthma, and what to do in case there is an attack. So it is important to understand that asthma is a genetic condition that is characterized by chronic airway inflammation that increases the resistance of the airway, and thus makes it difficult for the air to get in, and more difficult to come out, so that it becomes very difficult for the individual to breathe in. And this, when it happens, can be life-threatening. The good news is, if you know your triggers, and you know how to use the devices to deliver the reliever and the controller medicine, then you are safe. Of course, in acute attack, then we can use oral steroids. They become very essential. The use of oral steroids is not encouraged very much unless in a very severe attack, and it should be in the medical setup with the supervision of a medical person, because again, the oral steroids have a lot of side effects, and used unsupervised, they can also lead to serious complications. So thank you very much. I welcome any question about asthma, either in adults or in children. You may also share your comments. What have been your experiences with asthma? What have you been able to do? How have you known what are your triggers, and how have you been able to avoid them? So because we have said asthma is a condition that can be prevented, and it does not have to make your life unbearable. Once you know how to control the attacks, and to be able to know what are the triggers and use the devices correctly, then you can comfortably be able to use the devices correctly and be able to take care of yourself. So if you have any question, please pass it on. We'll be more than glad to help you understand this better. And if you have also been having asthma, You can also share with us what you have been doing to help when you have attacks. Because as I said, all of us have different experiences. This is something that we can all learn together and know how to overcome the challenges of asthma. And this is a common condition that affects quite a number of individuals. And knowing what to do when you have an attack is very, very, very important. So far I do not have. Yes, someone has Abros has asked, what about chest pain? Yes, when you have a severe asthmatic attack, chest pain can be there. But then know that chest pain is not one of the cardinal symptoms of an asthmatic attack. The commonest causes of the commonest signs of symptoms and signs of asthma include wheezing, there is chest tightness, and there is difficult breathing. So these are some of the things that you should be looking for. When you have chest pain, there are many other things that you can think of, and this will be determined by the age of the person, and also what other condition does this particular individual have. Because if, for example, you have a patient or someone who has diabetes, hypertension, and is having chest pain, the first thing that you will think about would it be a coronary artery syndrome, and then your workup should be in line to rule out the possibility of a heart attack or a coronary artery event, because those one would be the common presenting condition of this particular individual. And then also the family history. If you have had the asthmatic attack, you have chest pain, then the commonest thing that we think of about is possibly an asthmatic attack with a possible superinfection either by bacteria or virus, and this could be a pneumonia, which can be will be treated depending on the healthcare provider ingenuity, and so that it can be controlled. So thank you very much for asking that question. So yes, someone has asked, is asthma genetic? It is true that asthma is a genetic problem, but as I always say in many things, genes load the gun, but something in the environment pulls the trigger. So you have a genetic predisposition to get asthma. So for you to get an attack, then you have to be exposed to the trigger. That is what happens. So there's the genetic aspect of it, but the presence of environmental triggers is very, very important. Yeah. So in the absence of any other question, I'm grateful that you have joined us in this live presentation. It's our way of trying to reach as many people as possible, so that we know that diseases don't just show up. They have previous presentation, previous history, and when you know what to do, you are better off and you are in a better way to prevent yourself. So the take-home messages for this is that asthma is a chronic inflammatory condition which is characterized by blockage and narrowing of the airways, making it difficult to breathe. It will present with wheezing, breathlessness, and the chest tightness. And then the thing that you need to know is that there are triggers in the environment which you really need to identify which triggers cause your asthmatic attack, and then be able to look for ways to be able to avoid these triggers, and then know that asthma has two main lines of management. We have the relievers, which are short-acting drugs like salbutamol, the inhaled one. And then the most other important thing is you must know how to use the device that is delivering your drug the right way. We have the meter dose inhalers, which you have to check, and then grab it with your mouth properly and hold it with your lips. And then, if possible, it is always good to use a spacer. And then we have the discs, which you have to move the button that is used to move the drug, and then you have to be sure there is the presence of the drug, and then you inhale the disc in your mouth and take a deep breath inside. But the most important thing is the device that you have been given, where you are taking it, tell the doctor or the health provider who has prescribed it to you to teach you how to use it, and even when you buy, let the pharmacist teach you how to use it appropriately. So thank you very much. Thank you for attending this live chat, and thank you for being with us, and thank you for the support that you have given to us. I'm very grateful. Thank you for watching. Remember to follow us on the Overall Health channel. We have quite a number of videos there. We also have a blog on various health issues from the Wellness Health Services website, and I also have a newsletter in the LinkedIn, which is the Health Insights newsletter. And then we have the Health Insight 360 program. This is a program that we have launched recently for those people who have obesity. They want a special coaching to be able to lose weight. They want to control their diabetes better. They want to control hypertension better. Feel free to subscribe, and you can reach us through the number on the screen, and you can also reach us and book yourself a space through the Wellness Health Services website. Thank you for watching.